Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins. I'm joined today by Alex Lutz, the VP of Marketing and Public Relations at RUMC. We are joined by our guest of the day, Dr. Mahdi Ayat. He is our new nephrologist at RUMC, as well as Dan Ryan, the advertising director here at the Staten Island Advance. Welcome. Thank you for joining us.
Thanks for having me.
Of course. Through RUMC Connections, you will meet our fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. So let's talk nephrology. Kidney issues are on the rise around the world, with millions of people each year undergoing treatments for kidney injury or chronic kidney disease. About 1 in 2 people with very low kidney function don't know why they have kidney disease, and approximately 1 in 3 adults with diabetes and 1 in 5 adults with high blood pressure may have kidney disease. So Dr. Ayat is a full-time nephrology attending in RUMC. He is board-certified internal medicine specializing in conditions affecting the kidney and hypertension. Dr. Ayat obtained his medical degree in Iran, where as an emergency physician, he earned multiple awards and recognitions for exceptional patient care, including earning Medical Student of the Year and Distinguished Researcher in 2003. Dr. Ayat then came to the United States and completed his internal medicine residency at JFK University in New Jersey. As a board-certified internist, he further pursued his passion for nephrology and completed a nephrology fellowship at Maimonides Medical Center in Brooklyn, where he was also a chief fellow. Dr. Ayat recently joined Richmond University Medical Center and is treating patients for acute and chronic kidney diseases, hypertension, and perform hemodialysis, peritoneal dialysis, home dialysis, and screening PT for renal transplant. So welcome once again, Dr. Ayat. I would love to know what drew you to nephrology.
So let me start with my medical school. I always fascinated by the kidney physiology and also the pathology of those awesome physiology. So I think that was my main reason that I always interested in nephrology.
So as a society, I guess the obvious question, how are we doing in treating our kidneys? Are we doing well, or should we be doing better to take care of our kidneys?
Actually, I think we're doing pretty good, but we can do better. Mm-hmm. We can do better. So as a internal medicine or primary care doctor, so a job of doctor is to screening patients whoever are more susceptible to kidney disease or kidney conditions. For example, if the patient have mellitus or hypertension, so they are more susceptible for kidney disease. So it's a job of primary care doctor to screening those type of patients for any type of kidney disease and basically help those patients to get more medical attention and medications they need. From the patient standpoint, also it's important that they seeking medical attention if they have any of those conditions. We have multiple kidney disease that we can talk about it, but the most common ones, the kidney stones, cysts in the kidney, and kidney failure or chronic kidney disease, acute kidney disease. So each of those topics can lead patient to end-stage renal disease and need hemodialysis, basically.
You could talk a little bit about the relationship between the heart and the kidneys. So I would like to know, why is heart disease a main cause of severe kidney issues?
Sure. So basically, when we have a heart disease, heart cannot provide enough blood supply to the organs.
Okay.
One of the major organs that receive significant amount of blood is kidneys. So when we have a weak heart or we have a heart that has very weak muscles, so we don't have enough blood supply to the kidney, and we have multiple kidney injuries that is related to the heart. At the same time, when we have a high blood pressure, it at the same time affect heart and kidney. And so basically, patient will enter to the negative cycle, and the problem and pathology in the kidney affect the heart, and problem in the heart affect the kidney and make the condition worse, and patient need to seek medical attention.
So for kidney health, is there anything that people can like proactively do? Is it diet? Is it drinking a lot of water? Is it something that we could address physically?
Yes. So based on the chronic condition that the patient has, the recommendation is different. For example, if the patient has high blood pressure, so they need to seek attention, get the medication, and follow a specific diet to control the blood pressure. For example, low salt diet, less protein is good for those type of patients. But in other conditions like renal stone, kidney stones, that's different. So based on the condition of the kidney, the diet would be different. But generally, the hydration gonna be helpful for the kidney, basically.
As someone who's passed a kidney stone, it's not a condition I recommend to anyone or wish on anyone. Luckily, I had one episode. It's never happened again, but it's scary. It's a scary pain because it's so intense. And luckily, I was able to pass it on my own. I didn't need any kind of surgical intervention or anything, but it is quite a experience to go through a kidney stone. I can tell you that. And one of the things that is similar to Meredith talking about the relationship between the kidneys and the heart. Can you talk about the relationship between the kidneys and diabetes and what
sure.
it does to the kidneys and how you can manage kidney health if you are diabetic?
Sure. So in the diabetic situation, diabetic patients, we have two types of diabetic, type 1 and type 2. So it's important to look back to the general populations and see what's going to happen to them. So the majority of the patients that currently is on dialysis, they are diabetic patients. So that's the number one cause of renal failure in the United States. So it's very important that we educate the patients that this is going to happen if you don't take care of your kidney. So we have a term called diabetic nephropathy. When we have a high blood sugar in the body, kidney try to help the body to deal with these conditions, but in the expense of losing lots of nephrons and in the expense of some pathology in the kidney that in a long term lead to losing protein in the kidney, and those proteins can cause lots of pathology in the kidney. And basically, slowly, progressively over time, the kidney function will deteriorate. So we have lots of patients on diabetic, but the good news is we have medications to control that and stop the progression.
So the field of nephrology has changed from when you first got into it to now, I assume, the advances in treatments and techniques and technology and all of that?
Yes, actually, in the last couple of years, we have a new class of medications that help us a lot to control especially patients with diabetic nephropathy. So that's a big progress.
So what are the options for patients if their kidneys are failing to function properly? What options do they have?
Okay, so this is also one of other things that's always fascinating me about the kidney. Kidney is one of the organs in the body that is very forgiving and merciful. Basically, we do lots of things that is bad for our kidney. We try to deal with it. Basically, the kidney, we have two kidneys. 25% of one of them is enough for us to don't feel anything bad. That's very interesting.
Wow, that
But
is.
at the same time, that cause a problem, because when you reach to that point, that basically you lose 75% of function of your both kidney, you don't feel anything.
Yeah.
And when you reach to that point, so basically lots of damage is already done. So it's important that when your doctor tell you, okay, you have a kidney disease and you don't feel anything, take it serious. Back to your question, that what's the options? Also, this is also one of the things in nephrology field that I love. I can tell my patients that we will do whatever we can to keep your kidney healthy, to kidney good, and stop the progression. But at the end, if it's progressed and it's reached to the point that you need dialysis, your kidney stop working, we can offer you lots of things. It's not like a heart, that's okay, you're done. Or like a lungs, okay, you're done. So we have a transplant options. And it's very, very progressive programs. And it's very successful. The success rate is very, very high. And also we have a dialysis. So basically when the kidney is completely failed, we can put the patient on different type of dialysis based on the condition that patient is. So it's not end of the world.
Okay.
We have a lot to offer.
And the kidneys are the tough cookies of the organs.
Yeah, I guess so. That's what it sounds like.
Do they fail? Like if kidneys are failing, do they fail in tandem, or could it just be one that's an issue, or is it a thing that works as like as a whole?
As a whole. Okay, so based on the condition that caused that kidney failure, it could just affect one kidney or both at the same time. General conditions like hypertension, high blood pressure, or high blood sugar, like diabetes mellitus, it affect both kidney at the same time. But the conditions like renal stones, or cyst, or any type of obstruction, just affect one kidney. So we have one backup, basically. And that's why people able to donate a kidney. Basically, one kidney is enough to have a healthy life.
And is dialysis something that is seen as a standard form of care, or has that progressed to the point where there are other options and dialysis is not just the main decision made?
So when the patient reached to the point that we discuss the dialysis with them, we discuss multiple options. So first, our job is to stop the progression of the kidney disease. We diagnose and stop the progression. But when we reach to the point that, okay, the kidney is failing, or it's reached, for example, 5 to 10% of the function, and the kidney function is not enough to keep the patients healthy or active and situation to do daily activity, so we can discuss about the options. So before we reach to that point, we have a screening program for transplant, affiliated with two institutes, one in Brooklyn and one in Manhattan, and we can refer the patients for transplant. We do a screening and refer the patients for transplant. And we can do it even before start hemodialysis. That's amazing.
So transplant would be the preferred option to dialysis?
Yes, if it's possible.
Okay.
Okay.
But sometimes it's not possible, or sometimes patients need to be on the waiting list. So we don't have it like relative donors, or so other conditions like cancer or heart failure or other conditions happening, and patients would not receive the transplant kidney on time, and they need the dialysis. So we have multiple options. We have a hemodialysis, basically, that connect patients to the big machines 3 times per week. That's one option. Last couple of years, the government found and basically offer a home dialysis basically for the patients with the end-stage disease. So if they qualified, they can receive the machine at home and with the visiting nurse, so they can do the dialysis at home. That's awesome.
So if somebody finds out that they do need dialysis, is it a lifelong thing then, or do they eventually progressively get better and can come off of it eventually? How does that work?
It's depend to the condition of that they caused kidney failure.
Okay.
So if the kidney failure was due to the conditions that is temporary, yes, sometimes we put the patient on dialysis for a couple weeks or couple months. The kidney function improve and they out of dialysis.
Okay.
But sometimes no. Sometimes the kidney fail and it's not recover.
Yeah.
So they need lifelong dialysis or transplant.
Okay. Now, going back over what we spoke about, that heart disease can affect the kidneys and as well as diabetes. When you are dealing with a patient that might have been affected by that, how closely do you then work with the cardiologist or the endocrinologist? Do you have any relationship with them? Or?
Yes.
Okay.
Yes, definitely. Lots of medications that we prescribe for patients is basically medications that they also use. So we always talk with each other regarding adjusting the dose, switching medications, or how to control the blood pressure, heart rate, and also sugar control. So it's a teamwork, basically.
Most people don't think they need to go to the doctor for every ache and pain. So someone may have pains that are associated with the kidney. They may not think of the kidney. So they tough it out.
Correct.
When should someone go to seek medical attention that it could be something with their kidneys? What are some of the signs or symptoms that, hey, maybe I should go to the doctor and get this looked at?
Okay, so basically the kidney produces urine, okay? So any change in the urine, change in the color, change in the amount of urine, frequency, it's a sign that, okay, something is wrong. So if they notice any change, it's better to seek medical attention. The kidney, if you have any type of kidney condition that causes pain, the pain most of the time is on back and radiated to the groin area. So if they have a pain on that area, it's better to seek medical attention.
If it is a stone, you will know. I
Yes,
will tell you
I
that.
can- yes.
You will know. That's where it started.
That's a completely different category, and it's important that patients understand that, okay, the kidney stone, okay, is just kidney stone, but they have different types. So we cannot just give one diet for the kidney stone. For example, one patient say, okay, my doctor say, eat this, don't eat this. Another patient say, okay, no, my doctor said different things. So we check the urine, we check the blood, we check that stone if they have, they kept it. And based on that, we say, okay, this is the condition and this basically diet or these medications you need to take. So it's important that we evaluate them. It's not just, okay, this is a kidney stone and this is the diet and medications.
I'm curious, how would you like to see the care of nephrology evolve over time? Are there any advancements you think that would be helpful to the field?
Sure. So basically right now we're dealing with the huge amount of patients that the kidneys fail. It's around 808,000 people in the United States. It's close to 1 million people that they are in the stage renal disease stage, and it's significant, and that causes lots of problems for them and for their family. So I think we can do better to take care of the kidney before it reaches the point that okay, it's completely failed. So better blood pressure control, better sugar control, and better diet definitely can help. And also from the medical standpoint and healthcare, we can do a screening maybe a little better. So we diagnose before we reach to that point.
What about like an old wives' tale, like drinking cranberry juice is good for your kidneys? Are things like that true?
Yes, actually, the cranberry juice is one of the treatments, is like old school treatments, and it's very good for UTI, basically the urinary infection. So any type of fluid that basically hydrate us is good for maybe for 95% of kidney conditions. I can tell you that. Not for 100%, but for 95% of kidney conditions.
So Ocean Spray stock goes up.
Better than a kidney stone, right?
Absolutely. Oh, yes. Absolutely. Absolutely. So tell us a little about yourself. When did you come to the United States? What brought you over to New York? A little bit about your background.
Sure. So I was raised and born back in my country, Iran, in a small city called Najafabad, close to Isfahan. I finished medical school in another city called Shahrikord. And there I met with my wife, Parinaz. We were in medical school together. We did multiple research. We had a research group, Kavush, with a few other medical students. And then I pursued emergency physician. So we've been in emergency field for a couple of years with my wife. And then we decided to come to the United States. Mm-hmm. So that was a long journey for us, from that small city to come here and pass the boards and basically immigration and start from beginning. That was a long journey.
Mm-hmm. So what year was that?
So 2013.
Okay.
That was the beginning of the process, but it took maybe around 4 years to finally we settled. And 2017, I start my residency, and also after finishing, I start my fellowship. Actually, I changed the field, so I was in emergency field. And then I said, okay, it's enough. Emergencies, too much. So my wife also, same thing. So we came to internal medicine field.
Mm-hmm.
So as I always love nephrology, I came to nephrology field, and she's doing a pulmonary and critical care fellowship currently.
Yeah. And where is she? Where is she?
She's in SUNY Downstate, Brooklyn.
Very nice.
Yes.
Very nice. Wow.
Yeah, and then the reason that we are in Staten Island, this is interesting because I matched in Jersey, and she matched in Brooklyn, SUNY Downstate. So Staten Island was
Right
in the middle. So that's why we are here.
That works out. All right. Geography works in your favor.
Yes.
But I can understand that's a risk. You're leaving behind a country that you've lived in all your life to start this new life, and a lot of don't know how it's going to go. True. You don't know.
True. Everything new from beginning. And I always feel this pressure that when you come to the country, that everything is beautiful, everything is nice, one of the best country in the world. So I always feel this pressure and this responsibility to bring your best to the table and do your best, because basically you're using everything here. So it's better to do your best. And I always try to compete with myself yesterday and do better. And I think it works for me at least.
That's a great way to live, of course. And what do you like to do in your off time to decompress? Do you have any hobbies or things that you're into?
Oh, sure, yeah. So basically, we have 3 kids.
Oh,
so
okay.
they are completely keep us busy.
Yes.
I have
How old are they?
9-year-old son, 4.5, and 1.5-year girl. So 2 sons and 1 girl. So they completely keep us busy.
Yeah.
But I like to do woodworking. I do wood turning. I make stuff with wood, furnitures and like dishes and stuff with wood. So that's one of my hobby.
Oh, that's cool.
We do biking with my son all around the Staten Island. And the kids these days, they love play video games. So that's a good way to be in connection with them. So I can tell you, I'm professional video game player. Yes. So Call of Duty, Fortnite. Yeah, I'm professional, and my rate is on top.
Better watch out.
That's fantastic.
The things you should find
Yes.
out.
Yes. So my son always say, okay, my dad can beat you easily. And we play like a team. We team up and we play. I think this is a good way to connect with
Good bonding,
these
yeah.
generations. So
Definitely.
you can show yourself, okay, we are not out of the picture yet. We are there.
That's a good lesson. Man. My kid plays Minecraft all the time. He's like, Dad, I got netherite. I'm like, I don't know what you're talking about.
Yeah, I'm
So that's- I
I'm
mean,
a good,
that's a good
good
way to-
Minecraft player. Yeah. So Minecraft, Fortnite, Call of Duty, different versions. So yeah, you can find me there.
Taking down patients on Call of Duty.
I love it.
So, as a new physician on Staten Island with Richmond University Medical Center, take a few minutes to just let people who may be listening know what they can expect when they come to see you. What kind of care they're going to get from you?
Sure. So we evaluate their kidneys. Okay. So some of them maybe even they don't know they have kidneys until they come and meet us. So we try to get a picture of the kidney with ultrasound or CT scan. We prefer ultrasound. And do some blood work and urine tests to evaluate their kidney function. And go from there. If we find any pathology, we maybe ask for more tests, blood tests, urine tests, and basically evaluate them with all different type of tests that we have available. In RUMC, we have a very, very good team, and we work together. It's important that they understand that this is a medical center with basically teaching part also. So it's a university that we teaching their resident, we teaching the medical student and teaching the fellow. So when they come to this level of care, everything is up to date. Everything is in cutting edge, and they receive the best possible care. And I'm so proud that I'm part of it.
Great.
Absolutely. Well, we're very happy that you've joined the
Yes.
RUMC team.
Yes.
And we want to thank you for joining us today and all that you do to keep us safe and healthy. Thank you once again. And that about does it for this episode of RUMC Connections. Thank you for joining us. I'm Meredith Gaskins.
My pleasure. Thanks, Brian.